How about now?
Now it's working. Okay, all of a sudden, hey, my hearing aids aren't working.
It's time for Stages of Life Radio with Dr. David Klein. Have a medical question? Call 407-422-1212. That's 407-422-1212 or text 23680.
So interesting how that started before us. Hi, everybody. Welcome to the show. Here we go. There it is. All right, this is Stages of Life Radio. The phones are already hopping. You can call in and get on deck if you like. 407-422-1212. Text line always open at 23680. Yeah, how do I get a charge expunged from another? Nope, that must be from another show. Yeah. That's Dr. David Klein, your host with the most medical information. And tonight we're going to talk initially about foot pain.
Yeah.
Huh.
Those little feet of yours.
You know, my dad always told me that the best foundation is a good pair of shoes.
No question about it.
Okay, so
it all starts with a good pair of shoes. And so what we're going to talk about today, this is Florida after all. Mm-hmm. So, high style here is flip-flops. So if you're going to be going out to eat, sometimes they'll say, about shoes and whatnot. But flip-flops are almost always in style here.
Yeah, that and Crocs. I don't know
there you
what's
go.
up with those.
Crocs? Well, I don't know. Okay, but one way or the other, the feet take a beating. And yet, it's one of those sorts of things that is neglected along with much everything else in our life. What's wrong? Well, my feet hurt. Back in the day, many, many years ago, you'd come home from work. You'd kick off your Oxfords. Those are those lace-up shoes that Grandpa used to wear and I still have in my closet. And you'd soak your feet in Epsom salts and a warm bath. Let the puppies feel better. And you would feel better as a result of that. Or you would go out to the shiatsu, whatever the massage people. They come to rub your feet down, you feel better.
Oh, yeah.
So what is it about this? What is it about your feet that takes a beating? And what type of issues can cause foot pain? And why should you care? And the answer is because it's not always what you think. It's not always what is for dinner, let's say. So we're going to start off with some of the more common causes of foot pain, things that you may believe to be true, but may not be.
Okay, what?
So number one, so you're going to walk along and you're going to wake up in the morning and your feet are going to hurt and they're going to feel a little bit better if you rub them. They're going to ache a bit. Second toe, third toe may feel a little bit weird, fourth toe perhaps. And you're going to be told, well, this must be some kind of plantar fasciitis, because plantar fasciitis, after all, is very, very common. Mm-hmm. So then they start the injection process, and they start the orthotics and the metatarsal bars and all this crazy stuff for your feet, none of which comes for free, and none of it really works. And why doesn't it work? And the reason it doesn't work is that the diagnosis may have been incorrect. Everything works if used for the right reason. And it all depends on who you go to talk to as to whether or not you're going to find out the appropriate or the accurate reason. So in medicine, as it is in finance, as it is in show business, when you're a hammer, the whole world is a nail. So what you need to do as the consumer, and I'm not a big fan of medical consumerism. It wastes more of my time than anything else. People come in and they think that it's a discourse. Well, this is what I think it is. I'm delighted to hear what you think, but you're paying me for my opinion. Okay, so let me figure it out, and just let me do my thinking. And then the talking continues, the chatter, and then the 3-inch stack of medical records that really don't contribute much, because had they known what was wrong or figured it out, you'd already be better. So what are the causes of foot pain? So under these sorts of circumstances, these little teeny tiny nerve impingements can be misery and yet be highly inconsequential. So what I just described is something that the podiatrist might call Morton's neuroma. So you'll hear this Morton's neuroma. It's not a neuroma, actually. That's a misnomer. It's an entrapment neuralgia, the digital nerves, these little teeny tiny nerves that go between the toes. So when you become arthritic, as we so often do, the bones grow together, pinch the nerves, and wouldn't you know it, when you go to rub it, it gently increases circulation, it gently distracts the bone, and it makes it feel better. So you're going to go, well, gee, what do we do about that? And this is where it starts getting interesting. So the podiatrists, I have a lot of respect for them. I go to podiatrists the first thing I want to do is inject it, which is not an unreasonable thing for at least diagnostic purposes. But then ultimately it responds, or it results in, let's say, surgery to the foot. And that is where the problems often begin, right then and there. Because when you start cutting into the ligaments between the bones of the feet, it changes the architecture of the arch of the foot and leads to subsequent issues. So Morton's metatarsalgia is actually a better description. That the fellow Morton, okay, interesting surgeon of the foot, described entrapment neuropathy. Not necessarily that it's a neuroma, because it's not. It is not a nerve growth. It's a nerve entrapment. So why is it that you pass your way through life and then all of a sudden, for the past 6 weeks, 8 weeks, 12 weeks, 6 months, things are starting to get progressively worse? One, it could be the arthritis is getting worse. But two, now consider this, the nerve is passing through a canal formed by 2 bones, 4 ligaments. It's got a couple blood vessels and 4 nerves. So if any one of those things starts to swell, wouldn't you know it, the nerves are going to start to get compressed. What causes swelling of the feet? And then you'll find the cause of the Morton's neuralgia or neuroma or metatarsalgia. So it could be just simple fluid accumulation. So you've got somebody who's taking a high blood pressure medicine that causes ankle edema. It'll cause this to happen. Somebody with hypothyroidism will result in bilateral Morton's metatarsalgia. The same reason why they end up with bilateral carpal tunnel syndrome and bilateral ulnar nerve entrapment, bilateral saphenous nerve, bilateral headache. So bilateral foot pain of this nature, you'd better start looking at the thyroid. One way or the other, it's going to be influenced there. So these are the sorts of things that can result in foot pain. So you're looking at the feet as the problem, and yet the cause may be in the neck. You're looking at the feet as the problem, and yet the cause may be the heart or the kidneys, or it might be the liver. So these are the sorts of things that we're going to discuss today first before we start taking telephone calls. What other sorts of things can cause foot pain that'll drive you completely mad? Here in Florida and elsewhere, women wear shoes. Wouldn't you know it?
Huh.
Okay,
Shoes.
Yeah, shoes. Yeah, well,
okay.
Yeah, it does happen. But there are nerves on the top of the foot that can cause pain like this. My favorite one is the deep perineal. Now, we started off talking about flip-flops. Wouldn't you know it? When you're wearing flip-flops, those of you in the northern climates, you sometimes wear these when you come to visit us in Florida. But the rest of us down here have at least 10 pairs of these things because they have to match the rest of our clothing.
Well, yeah.
So when you're wearing a pair of flip-flops, it puts pressure directly on this particular nerve. Okay, it's between the great toe and the second toe, and it innervates part of the great toe and almost all of the second toe. So why does this happen? Oddly enough, for the same reason as the Morton's metatarsalgia. It can happen as a result of arthritis. It can come from trauma, compression trauma from shoes, but also strappy sandals will do it. Also tight shoes or poorly fitting shoes. So what do we do when we go to buy shoes? When women buy bras, what they do is they wear the same size. They put on the same size they did when they were in high school, knowing that they're bigger than they were, and yet when you look at folks, you can see these grooves cut into their shoulders and grooves cut into their backs because they're too small. The same thing is true of shoes. Your feet will actually grow with age, right? Okay. Yet you're still wearing the same shoe size you did when you were in high school. So once in a while, like every time you buy shoes, you really ought to have a professional do it for you. Get measured properly. Why would I say such a thing? Because when I was getting married, I couldn't stand the shoes I was using. I thought there was something wrong. Turns out that I had the wrong size. I'd been buying the same size at the discount shoe locations, and I'd walk in there, buy a $60 pair of shoes, and end up with $30 worth of benefit because it didn't fit properly.
Got one on the text line real quick. Right heel constantly burning for 2 months. I'm not on fire, Doc. So what's the deal?
Okay, differential diagnosis for heel pain. If it's one heel like that and it's just in the heel, I would be looking behind the heel for something called cystic degeneration of the Achilles tendon, and we'll talk about that after these important announcements.
Yep, 23680, that's the number to call, to text in, just like that wonderful text. Appreciate you.
Yeah, we'll get that one. That's an easy one, by the way.
That's an easy one. And, of course, other medical stuff, we'll take care of that, too. We've already got somebody on hold, Shelby, who wants to talk with the doc. So all these things and more coming up. Stages of Life Radio. We do this 4 to 5 on Sunday afternoons, but you can always get a hold of the doc at Stages of Life, medicalinstitute.com. We'll be right back. You're listening to Stages of Life Radio on, wow, what is it?
WFLA.
News Radio. Thank you.
Hey, it's one of the other 13 stations at some time or another.
All of a sudden it went to that R word. I almost said real. Hey guys, all right. Let's see. We got a couple of we got a lot of people watching us online. Hey everybody. After giving birth, shoe sizes change as well.
You betcha.
Thanks,
well,
Mel.
That's a big deal. Yeah. What happens is your ligaments become lax.
Uh-huh.
So why would this happen? Teleologically, the explanation is this: when you're getting ready to give birth, in order for you to squeeze that kid through your pelvis, okay, that's an easy thing to do. The ligaments holding the pelvis together have to become lax so they can separate. And this is the same reason why your feet kind of splay a little bit, the arch drops, but also your hips got a little broader, didn't they? Okay, so if you're going through vaginal birth, the hips kind of slide apart in a way that is less than desirable to some people. Other people find it to be rather attractive.
Yeah, move right in. Burrito hips. But, yeah, even when you actually are pregnant, I've seen a lot of women, the legs just...
They do.
And the feet swell up, and they never really all the way go back to that original size.
Well, the swelling is one thing, okay? Swelling may be due to compression of the veins in the abdomen.
Right.
But the ligaments start to become lax and the feet tend to flatten. Okay, so they flatten lengthwise, they flatten sideways, and so the shoe size will change, and you actually have to go in and have it checked out. Your bra size will change.
Oh, yeah.
So I used to send people to Macy's. You know, they'd come in and they have chest wall pain from a bra that didn't fit well. Now, you want to talk about a problem. So they're spending many, many hundreds of dollars on all kinds of different treatments to find out that the main problem was they didn't have the proper bra size. So you really can't measure yourself and do a good job. But these ladies that sit in these lingerie departments know what they're doing. Look, pay the extra $10.
Every one of us where I'm from has been felt up by the same old ladies. Okay, yeah, we used to talk about. We still talk. We're all a little touched because of it.
Well, yeah, no kidding. But what do you do if you're a guy like me and you want to identify as the lingerie lady?
Yeah, not good.
Not good.
It doesn't work out well. I think we're going to have a good time with Shelby here, by the way, when you get on. Something about liver issues and bioducts, and specialists can't figure it out.
Cool.
Yeah, that'll be fun.
We're running a special on livers.
Really? A special on liver?
No.
Ah, damn.
It sounds good.
It did sound good. You were very convincing, and we got like a half a minute here. We got a lot of people watching us on Facebook and on the social media. We're
Marvelous.
On Twitch. We're on Periscope and a couple of different places.
Well, I'll be impressed when we go on Parlor.
Ooh, she said three huge babies, 5.5 to 7.5.
I was 9'8". That's a big baby.
I was 6'8", and that's or 8'6", excuse me.
8'6" is big enough, yeah.
And I was supposedly being percolated for another 3 weeks when I popped out.
Yeah, surprise!
All right, stand by. Let's see if we can
Somebody
actually time this
got the numbers wrong.
It could happen. Hey, welcome back to Stages of Life Radio. I am Melissa Fox, and with us always, it's the doctor. Doctor's in. Dr. Klein, David Klein, that is, of Stages of Life Medical Institute in beautiful Longwood, right off of I-4. Yeah, right. You must hang one there at Booth Circle. It's off of, it's right across from the Four Rivers. You really can't miss it, yeah.
It's a piano's throw off of I-4 at 434.
Yeah. Bing! Throw the piano. See if you can do it. So, we got some people lined up on the phones, 407-422-1212. The text line's got a couple of questions on here as well. That would be 23680 if you want to text in a question to the doctor. We are talking right now about foot pain, and when we left, we had a text here from a wonderful person talking about right heel constantly burning for 2 months, but says I'm not on fire.
Yeah.
And therefore, I don't understand what the heck's going on.
Yeah, okay. When people present with this type of situation, the rarer causes might be something like a calcaneal fracture. That's a fracture of the heel bone. Unlikely. It's been known to happen, but it's highly unlikely. Sometimes you're going to see a little bit of a tendonitis there. Sometimes it's tibial nerve entrapment. But the most common cause of this type of situation is something called cystic degeneration of the Achilles tendon. Now, the Achilles tendon is that heel band. It's a kind of it looks like a bowstring, goes down and attaches to the back of the foot, ankle more precisely. but the place gets damaged. It could be damaged from direct trauma from a door, direct trauma from something that kicked you, rolled into you, banged into you. But most typically here, and I assume it was a gal that said this.
I think so.
Yeah, it's actually the straps on your shoes. And so it rubs along that area and causes something that the orthopedic surgeons will call pump bumps. Ah. And what this is an area that starts to degenerate and starts to become painful. What you don't want to do is to inject it with steroids.
Oh, gosh.
Because should you do this, it will weaken the Achilles tendon over time, and it can rupture. Now, if that happens, it is a major disaster.
Talking drop foot.
Not so much, but it's just a misery. You can't use your foot very effectively, and it hurts just to walk or do anything you want to. So generally what I do for this is I use topical anti-inflammatories. My preferred one is called Pennsaid, which is a DMSO-based diclofenac, 2%, and the stuff is awesome.
It works really well.
It works like a champ. It's expensive as stink. If you have Medicare, you can't get it because it's just too expensive.
Happen, yeah.
However, with commercial insurances, you can get it. And they have all kinds of plans where it can cost you as little as $25, but it's $3,000. Okay. If you don't have one of these plans.
So you just texted back in all caps, "No, I'm a guy." Well, clearly your pumps are bothering you.
Well, no, he's a guy. Well, I don't know.
Sorry,
again,
dude, I don't know.
No, well, if the fact that you wear pumps is these days it doesn't seem to really raise too many eyebrows.
However, could be a work boot,
but it could be work boot.
It could be whatever. But the case is that
in which case it's gas pump boot. So yeah, but that's generally what does it. And so, but Pennsaid, okay. Now, the funny thing about Pennsaid, this stuff is a world of awesome, but it's limited in the way you can get it. And so your doctor can write this prescription for you. It's got to be sent to a specialty pharmacy because they know how to lie on the prior authorization forms. But the instructions have to be this: 2 pumps to the knees bilaterally twice a day. Wink, wink, nod, nod. Point to your knees, and then you're going to point to your ankle. And it works beautifully. It is just one of those kinds of things that is just a wonder. And you do it 2 or 3, 4 times a day to start. You can back it down to twice a day, 6, 8, 12 weeks, and you're done. This is the stuff that I use for my wife's neck. Now, she broke her neck. So she applies this behind the neck. It goes through, it penetrates into the area where the facet joints are. Some of them used to be. And it settles things down so she can sleep at night. Does it penetrate? The answer is affirmative. Does it do it effectively? The answer is affirmative. Is it expensive? The answer is affirmative. Yep. Now, sometimes you can have it compounded, in which case it'll still be a little bit pricey, but not too bad. It's one of those times when you'll pay $100, $150 and be grateful for it. Why? Because A, it works, and B, it's a lot cheaper than $3,000. So that's what I think. So it's called cystic degeneration of the Achilles tendon. What else do we have online?
Oh, online? Let's see. My fingernails split and break. What kind of nutraceutical should I take?
Okay, well, I'll tell you what you're likely to do and how you're going to screw things up. Okay, so when people present like this, they say, well, I'm taking 5 to 8 milligrams of biotin. I take biotin, and biotin helps me. No. And then I go, marvelous. Okay, because most of the time that people have these sorts of issues, it's a thyroid problem. So, and so the skin, the nails, the hair tend to grow abnormally under these circumstances. Sometimes kidney problems will do it. But when you take biotin to try to correct this, it goofs up the doctor's ability to diagnose thyroid conditions. Most doctors don't know this, so you'd better know this. So if somebody's going to go in and check your thyroid out and you're taking biotin, it scrambles their eggs with regards to being able to diagnose thyroid issues. And if you don't believe this, go to Dr. Google and Google thyroid space plus biotin, and you're going to be shocked at what pops up with regards to the caveats for not taking this stuff if you have thyroid disease and your doctor has to monitor you. But you can take something called UC2, which is a type of collagen. Okay, and that will help tighten things up a little bit. And the second thing you can do, and this is really going to sound goofy and very self-serving, but there's a product that we sell called Kinkies, which is MSM, and it's transdermal. And if you rub it on your hands, you do it before you go to sleep at night, you do it sometime during the day, it increases blood flow to the hands and fingers and fingernails and promotes nail growth. Does it work? And the answer is yes. It works effectively and it's cheap.
Very nice. Okay, we have Shelby.
Okay, Shelby.
Hi, Shelby.
There we go. We almost had you there, Shelby. What you got?
I have last year I went into a regular checkup of my liver, and my liver enzymes were elevated.
Okay.
Since then, I've been seeing a liver specialist, and it turns out that my bile ducts are scarred.
Okay.
And it's causing bile duct buildup. So I've been in a couple of ERCPs, and my liver doctor has concluded that I may have PSC after checking everything else. But he hasn't concluded.
Okay. Did you ever have salmonella poisoning? Food poisoning?
No.
Okay.
I've never been diagnosed for it.
Better answer yet. Okay, salmonella is a funny kind of a disease. There are diseases of the gastrointestinal tract, salmonella being one of them, which can infect the gallbladder and the biliary tract. So you can end up with ascending infections. So Typhoid Mary, back in the early part of the 20th century, was one of these individuals that killed a bunch of people because she was excreting salmonella typhi, in her poop, and was in fact infecting a lot of people with it and killed a bunch of people in the central part of this country. So what is it that could have scarred down your biliary tract? And my bet is it's going to be an infection. Now, is there anything you can necessarily do about it now? There are a couple things. And the reason why you're calling is, gee, what can I do to make this feel better or do better? And there's 2, maybe 3 things that I would like you to add to your diet that will thin the biliary secretions. And you're going to go, well, why would you want to do that? And the answer is very simple. If you've ever had acne, you know that the cysts will drain if the pus, purulence, wax, whatever's in there thins out a little bit. If you have an abscess someplace, it will drain, typically, if you thin it out. That might be a hot compress. It could be a lot of different things. Poultice. But in this case, you can thin the biliary secretions using 3 things. 1, N-acetylcysteine, NAC. Second thing is called guaifenesin. Okay, you'd know it as Mucinex, but the generic guaifenesin is what you're shooting for because it's much less expensive than the branded product. And then the third one is called L-theanine. That's Theanine. So theanine is an amino acid. Your body will use it as an antioxidant, but it also will help facilitate drainage of the gallbladder. And you do this for about 6 weeks, 8 weeks, longer. But sometime around the 3rd or 4th week, you add milk thistle to your diet. And then all of a sudden it starts washing out the gallbladder and biliary tract. Okay, this is Ayurvedic medicine. So this comes from South Asia. Okay, the land,
Okay.
That's the way these things go. But that's how you do it. N-acetylcysteine, or NAC. You can go on, if you choose to, you can go on stagesoflifevitamins.com and just type in acetyl, ACETYL, or you can type in NAC and it'll pop up. That'll show you what you're looking for. The dosage is 500 milligrams. If you find the 600s, it works every bit as well. And you take it 3 to 4 times per day. So it might be breakfast, lunch, dinner, bedtime. You add to it guaifenesin, sometimes known as Mucinex. And you do that 4 times a day. And the L-theanine is 200 milligrams at bedtime. Wait 6 weeks and then take silymarin, which is milk thistle, and you do that 3 times a day. And then all of a sudden, things start to clear out. How long do you stay on this? With a history like yours, I'd stay on it. So let's give that a try, my friend, and see how you do.
All right, Shelby, good luck on that. We're getting close
Shouldn't
to
be a problem.
break here. There it was. There was their
They
orchestra.
told us. It's right there. The orchestra kicks in, tells us it's time for us to move
It's
along.
amazing. 407-422-1212. Shelby's line is now open for you. And we have some questions we're going to answer off of Facebook. Looks like Tanya's got some problems with her feet. And yes, we know, sir. Nobody wears pumps with shorts on a wife beater. Thank you for checking in on the text line, 23680. This is Stages of Life Radio on News Radio, WFLA Orlando. Good one, dude.
I like it.
He's pretty clever.
He looks marvelous in his pumps.
Yeah, well, the wife beater and shorts. Okay,
And a
so
tiara, no less.
Melanie wanted, and of course the tiara was given. Melanie said that she had 3 huge babies. Her feet went from a 5.5 to a 7.5.
Yes.
Shoe size. Tanya says she's got lots of broken capillaries in her feet. What vitamin might help this?
Okay, something called horse chestnut. And the dosage is between 400 and 500 milligrams per day. Just take it once a day. Horse chestnut. And does it work? Yeah, it does. It's kind of interesting stuff, actually. So good luck with that. But again, so here's an individual who sat back and measured the shoe size. Now, the other thing you're going to find, Tanya, over time your feet will continue to flatten a little bit, and they're going to get bigger. As are your ears, as it turns out.
Yeah, ears grow.
Ears grow. You know?
Yeah, I can't do nothing about that. I'm serious. They do. They grow.
So what else we got?
Hold on. I can't tell you everything at once. I may have blocked Melanie by accident.
Oh, sorry, Melanie.
Sorry, Melanie.
Send it again, and we'll get you back in there. Sometimes we hit the wrong button by mistake. Except for you, we did it intentionally.
No, yeah, you were.
You know, I mean, really.
Come on.
We pick on you routinely.
Yeah, where's Izzy? That's what I'm missing.
Iggy?
Iggy is missing. Iggy's missing an act.
We'll have to send out the police to do a well Iggy check.
A wellness Iggy check, yes, indeed. Anyway, let's see what else we have. We've got a couple of things going on here. Lizzie just checked in. She said she wanted to know about what you're doing for. I told her foot pain for Tuesday. Why not, right? We'll continue it. Yeah, plus I got a 1 foot shorter, or one leg. Like most people, one leg is, but mine's significantly shorter than the other. Makes a big difference in foot pain.
Well, it makes a big difference in hip pain, shoulder pain, and headache.
And lower back, not to mention my neck as well.
Yeah.
I know. We have a question. As usual, the vaccine people are floating.
Oh, the vaxxers are back in.
Yeah, so we'll answer that real quick.
I threw away all my masks, just for the vaxxers.
I had a friend who put on Facebook that anyone who wears a MAGA hat and doesn't wear a mask probably did not get a vaccine and is a Trump supporter. And I'm like, well, that's not even close to right.
I'm not trying to figure out what that's.
Where did that even go?
James Brown's one of my heroes.
James Brown. Well, he's a good guy, but Dr. David Klein is the guy
we're
talking about right now. Welcome back. Stages of Life Radio. Go to stagesoflifevitamins.com and just check out all the wonderful nutraceuticals and such. Stages of Life Radio. You can listen to the Doc Talk 24/7. And, of course, Stages of Life MedicalInstitute.com. Become a new patient. Call during business hours at 407-679-3337. I think I covered all the bags.
You got them all. But I want to mention one thing on the Stages of Life vitamin store.
Yeah, go.
Okay, and that's this. And we have a product there called Down to Basics. The one you want is Down to Basics without iron. Okay, unless you're a heavily menstruating female. Most people are not. And this is the most cost-effective multivitamin mineral product you're ever going to find. Okay. So why am I saying this? Just check it out, look at it, and figure it out, because there are products that you'll see on TV that offer a great deal less and charge 4 times more. So it's a value play, it's a quality play, and it's one of our more popular offerings. Down to Basics without iron. We do have with iron for folks that are anemic.
If you really need the iron.
If you're anemic.
I've got a question here off of the text line, because, over the weekend, the CDC, last week, they came out of nowhere wagging the dog.
Yeah. Mm-hmm.
Ignore this over here. No more masks.
Don't pay attention to the hand.
Now, here's the thing. Now, we know that you got your vaccine like the day after the Capitol insurgents.
Yeah.
Anyway, you were set. Why did
how
they
many
wait?
insurgencies go in unarmed? I'm just,
I know. I
mean, really.
I know, we digress. But point is, you got your vaccine. You guys were fully done by February. And yet it took until May for the CDC to go, that's right.
Well,
you are vaccinated.
Here's the thing that's kind of interesting about the vaccine at all. So at Stages of Life, we do something that you can't find, I don't think, any place else yet. And that's, we can quantify the amount of antibody that you have in your system. So after you get the vaccine, even before you get the vaccine, we can measure it and see whether or not you have any resistance or any protection at all. So we've had people come in with the Johnson & Johnson vaccine, 2 so far, that got the vaccine and generated no gamma globulin response.
Oh.
Okay, so now you can think that you're a month after the J&J, but until you really check the IgG levels, that you're not going to know what's going on. We do that for, I think, $49. So it's very, very inexpensive blood draw. Check it out and know what you've got going on. So like my level for IgG for COVID is over 60. We've been doing, I think, 10,000 of these so far since January. And which is a tremendous amount of data. I'd love to be able.
It's a lot of data.
I'd love to be able to share it with the CDC, but nobody there answers their phone.
They're too busy.
They're too busy taking your money and giving you nothing except they give it to the Chinese so that they can develop these marvelous
weaponized viruses.
Weaponized chicken virus. So what have we got? Okay, so the amount of gamma globulin will tell you whether or not you have immunity. So I know mine is at 63, which is very, very high. My wife is in the 20s, also very high. After getting the COVID, the infection itself, you rarely see a gamma globulin over 7. So think about that for a second. If typically we hit 30, 40, 50 or higher after the injection, but you only get 2, 3, 5 after getting the vaccine, you're not getting nearly the degree of immunity having had the infection that you do as you would getting the inoculation. That is interesting. The other thing that we're watching is the degradation in the value of the gamma globulin over time. So they say, well, this should last a year, it should last 6 months, 8 months. How the heck could you know that unless you measure the amount of gamma globulin?
Yeah, that's...
So we're looking at it, and so it degrades roughly 3 to 4 IUs per month. So if you've got an immunity at 9, it's good for 3 months. So we're seeing patients coming in now with their second and third COVID infection. Think about that for a second. So, well, if you had the inoculation or if you had the COVID, you're immune. That is absolute utter nonsense.
Yeah, I just don't understand why they're doing what they're doing. But I'm
politics. It has nothing to do with science.
Like I said, initially it was wagging the dog. Don't worry about the border crisis. Don't worry about unemployment. Don't worry about inflation that's gone through the roof.
Well, there's no such thing as inflation.
But you don't have to wear your masks now if you're not.
Yeah.
Hey, let's get to the phones. We've got a lovely gal here. Carol. Carol's on the line. Hi, Carol. How are you? Carol. She's a little shy.
Earth to Carol.
She's there. Carol is 85. Hi, Carol.
Hi.
There we go.
There you are. Carol, you sure don't sound 85, but she says she's...
No, I don't feel it either.
Oh, Carol, can you put your mom on the phone, please?
Yeah, right. Can we talk to your mom, young lady? You shouldn't be answering the phone. So it says here you suffer from AFib, your lower legs feel warm, and you wonder...
Yeah, I've had it, oh, God, since I was 65.
Okay, so it's been a while.
20 years I've had.
Yeah.
I don't think it's anything to do with it. I don't know. But I've never had this before. It's my lower legs and my feet feel warm. And I keep thinking I'm always trying to figure out what's wrong, right?
Yeah.
So I'm thinking maybe is my heart pumping the blood back up from my feet is that a heart problem maybe?
Okay, well here's the reality. Your heart pumps blood away from itself, not towards itself. So when the pump goes down the legs, but in order for blood to work its way back up, it's done passively. So when you move your muscles, move your legs, they squeeze the veins. The blood is squeezed upward, and then these veins have little valves in them that keep it from going back down. So if your legs are feeling warm, it's not a problem with the arteries, but you may well have problems with the veins. So they call this venous insufficiency. Do your legs have a purplish color to it, or like a ruby?
I have veins in my legs, yes.
You have veins. We all have veins in our legs. That's a good thing.
That is a good thing.
I've never had trouble. They're not that real. They're not big, but I've had.
They're prominent.
You can see them.
Yeah.
They extenuate.
So more than likely what you've got going on is a problem either with varicosities of the vein, okay, which is something that you can live with. You can live with it. It's not going to be a big problem typically. But you need to be careful that you're not developing things like blood clots, which then will make your legs feel warm.
Eliquis.
Oh, there you go. Okay, so that may be what's going on here. What I'm going to suggest that you do, okay? Now you're taking Eliquis, and they're going to tell you not to take aspirin. I'm going to tell you that were I on Eliquis, I would take a baby aspirin anyway, because they do two different things.
Oh no, I don't.
I know they tell you not to. I do. You know, that's kind of the way I practice medicine. So I do it a little bit differently. The second thing I would have you do is to take a fish oil, a quality fish oil, because it decreases the viscosity or thinness of the blood, so that it actually decreases the chances it will clot.
I've been wanting to take fish oil for so long.
Please do it.
I can't.
No, you can. No, your body doesn't have a shortage of Eliquis, but it may well have a shortage of EPA.
Now she's on blood thinners. Is
right.
this? that going to have an issue?
That's why I'm talking her through it. Yes.
Right. I was going to say, wait a minute. So she should be on the oil.
You would think so. Okay. Yeah. Now the other thing about Eliquis is they'll tell you not to take fish oil, but they don't tell you not to eat fish, right? Now think about that for a second. If that makes any sense to you, then I really need to understand my chemistry a little bit better. Fish oil is not a big problem. It's a theoretical concern. I've never in my career seen it to actually cause a problem. But the last thing is the most important. So if you have AFib, are you taking any something called coenzyme Q10?
No, I take metatoprol.
No, what I'd like you to, baby girl, what I would like you to do, okay, is to get something called CoQ10. The dosage is 300 milligrams. 300 milligrams or more per day. Start off with 300 milligrams. If you have to, bump it to 600.
One a day.
Well, the 300s, it depends on the size of the capsule. So if they're hundreds, you take 300, start off with one per day, and then in a month or so, double it. All right, and see if that doesn't help flip the atrial fibrillation back to a normal sinus rhythm. So in Europe, in Europe, it's a primary treatment for angina and for atrial fibrillation. Here, they don't talk too much about it. Now you have.
Right.
So give that a try. The worst thing that's going to happen. Worst thing that's going to happen is it's going to cost you $20. Yeah, you're going to be fine.
You're going to be fine. I'm so glad you called, Carol.
God.
All right, baby.
Oh, I'm going to have to come and see you.
Yeah,
well, looking forward to it.
Good idea. You can always become a patient of Dr. Klein's.
Happy to.
Yeah, you can call up during regular business hours, 407-679-3337.
And when you come in, remind me that you called on the air.
Yeah, that's always cool,
it's very cool.
He loves to meet the people that he's talked to on the radio. It makes it even more of a special relationship. We've got a challenge coming up for you in our own family. They're going to...
is that right?
Oh, yeah, right.
Here we go.
Yeah, or she's going to love this. But we've got the lab work already. We're just going to be heading down soon enough to find out. This is the Hashimoto's and a million.
Well, running a
things.
special on Hashimoto's.
Here's the question. Ready to be treated by Dr. Dave.
All right, let's see what we got.
I wanted to ask wanted to let you have some questions in case you forgot.
In case I forgot? She knows me.
No, let's see. Do I need to order blood work? Do you have to order blood work for her, or can she just go to LabCorp and get results that she already has and bring them to you?
No, both, actually. The best way to do it, the more data that I have, the better job I do.
Okay.
The more recent the data, the better the data. But having data points in the past is extraordinarily helpful.
Okay.
So both.
There you go. All right. Again, always accepting new patients. Loves taking Medicare and, right?
Medicare, TRICARE, Cigna, and there are a handful of others.
Stages of Life, medicalinstitute.com. Click on the new patient portal and find your way around all that good stuff. We'll be right back. We got another 10 minutes or so to spend with you, so get on the line at 407-422-1212. Stages of Life Radio on News Radio WFLA Orlando.
Got it right that time.
I did, didn't I?
Yeah.
Oh, where was dumb sister call? I almost had her. Let's see.
What else?
Hey, where's your sister?
Was that my sister's text?
Yeah, is she gonna call? Someone just called. That's not her. Someone's calling now.
Someone's calling now?
Yeah, I'll tell her to call right now. I thought she was gonna call. She said she was gonna give me information, then apparently she didn't.
Well, that's the problem with these telephones. Newfangled telephones.
It's a new thing. Yeah, I know. And everybody's really hip to it. Hold on, we got her. Great
and
test.
if you notice that I'm not wearing a Stages of Life shirt
today. I did notice that today. What's up with that?
I just chose not to. It's a wardrobe failure today. I decided to wear another one of my Harley Hawaiian shirts.
Oh, I see.
Well, that way I'm incognito.
Yeah, you are.
People won't recognize me.
You most definitely are. Let me just look and see what I did here. Great test, the antibodies test. Yeah, right now, goofball. You're not going to get through.
Oh, he's trying to call the office now? On Sunday?
Call me.
Oh, call you. Ah, there we go.
I'm trying to get her sister to call. I'm just doing my math here before I mess this up. Math. Okay, way too many people here. Tanya said she had the antibodies test. It was great. How about that?
Oh, good. That's, yeah. It's not like a roller coaster ride. I mean, you just get your blood drawn. We run them on Sundays. Every Sunday we run them, actually.
Really?
Yeah, because I have one technician that comes in to do them.
Special.
Yeah. Well, it's like much of anything else. It's when you batch the studies, it reduces your overhead. So we're able to keep the price of the darn thing down. What's interesting about the quantitative antibody studies, okay, is again, it's supposed to be an expensive test if you're able to do it. And given the fact we're the only ones that actually do it, by batching them once a week like that, we are able to keep the price below $50. So,
wow.
Yeah, that's pretty cheap.
If that's her.
Now, PSA, if you go to the big boxes, $150. We do this for $20. So, these things may sound like they cost a great deal, but if you are in the right place at the right time, it's not that usually not that pricey.
Okay. All right. I got a call from Ruby, but we're just gonna talk to her because I think the other one actually called in here. So.
Okay.
Yeah. Okay. Time is like time. I'm looking and everything just stalled out on me. Oh, there we go. Okay. Alrighty, Ruby, it's from Titusville.
Excellent. I was just out that way yesterday.
Were you?
Yeah, spent a little time on Merritt Island, bopped around a little bit.
Both of her feet burn, but only when she's in prone position.
Really? Okay.
New bedding.
Yeah, it could be. But there are other couple possibilities. So if she's in the prone position, that's on your stomach, okay, then your toes are going to be extended, your ankles are going to be extended. That's going to stretch something called the extensor retinaculum, and that could be superficial.
Wow, we're diagnosing during the commercial breaks.
Perineal nerve.
Okay, so Ruby just was checking in. She's 60. The bottoms of her feet burn, but only when she's in the prone position, which would be on her stomach, Doc. So what the heck is that all about?
Okay, so when you're sleeping on your stomach, okay, unless you have holes in your mattress, your toes are going to be extended, your ankles are going to be extended, like in the Superman flying posture.
Arch issue then, too.
No, bottom of the feet. Okay, so what nerve is going to get tweaked for the bottom of the feet? It's going to be one of two. It's either going to be the tibial nerve behind the medial portion of the ankle, which gets stretched in that position, or it's going to be the extensor retinaculum nailing something called the intermediodorsal branch of the fibula, which will cause pain on the bottom of the foot on the lateral aspect. So this sounds like a nerve issue, nerve entrapment. So, what do you do about that? There are a couple of things you can do, one of which is don't sleep on your stomach. That would be the obvious. The other thing is to use a topical anticonvulsant, and the one that I use is a mixture of ketoprofen and gabapentin and a base called wrench anhydrous. So it goes right after the nerve sheath, actually. Works in about 30 seconds. It's a marvel, actually. I developed this stuff 20 years ago to treat carpal tunnel, and you can do tarsal tunnel, which is what this is, the same way.
Cool. All right. 407-422-1212. So Ruby, I hope that helps you out.
And I'll be happy, Ruby. If you need, just you can. That'd be something I'd be happy to see in the office. Actually.
Yeah.
Because it's a challenge. I like the ones nobody else can figure out.
I know it was a challenge. We got a challenge, I think, coming up for you on the phones.
Cool.
Here.
What do we got?
Screening them at the moment. Let's see.
You're screaming at them?
Screening.
Oh, screening.
Screening.
Ooh.
Call screening.
Well, sometimes I have people scream at me. It does happen.
Okay.
You're wrong.
All right, so now she doesn't want to be on the air. Okay, well, I can't answer her questions if she's not on the air. Okay, I can't answer her questions. Okay. All right, well,
what else have we got?
Anyway, we have a lot of other things here, so, okay. Yep. Okay, so no one was... Oh, why do children need a vaccine if the data shows they have a very low incidence of getting severe symptoms?
Because they may survive the virus, but they're going to give it to other people. So there's a thing called a team sport. Okay, you may not be the person that makes the touchdown, but you really do need to participate to get the ball down the field. So if you have a bunch of screaming kids that come down with coughs and colds, and they're going to give it to other people, including their teachers and the people around them. Mm-hmm. Why is it that the kids always bring these colds home to their parents? Therein lies the problem, that the kids have to be inoculated also, because if they don't, they become a source of infection for the real human beings, the adults. The real ones, right?
Yeah,
so, yeah, but there are bugs that damage kids and not adults, pertussis being one of them, whooping cough. Whooping cough will kill a child, but it just results in chronic cough for older people, adults. So why should an adult get a DPT shot? To protect the kids. It's all the same thing, as we have to protect each other. So that's why you do it. It's not just a matter of, well, gee, the kids aren't going to die from it, but you might kill your grandma. Feels real good when that happens.
No, that is not a good feeling.
Yeah.
Okay. Let's see. Rob's checking in, says, Doc's my doctor. He's
there
the
you go,
best
Rob.
doctor ever. Okay, and let's see. They called in, but she didn't want to go on the radio. She's scared. So.
What are you scared of? I do this all the time. Nobody's shot me yet.
It's okay. Says it's complicated, not simple.
Ah,
all right.
okay.
No, I get you. It's all right. We get the... my name is Ruby. And I'm 60.
There we go.
Hi, Ruby. She's back on the text line now. 23680 is the text line. Very good. Okay, so Doc, on recapping the foot thing. Now, I was saying before the break that I actually have scoliosis, and one of my legs is about 2 centimeters shorter than the other,
Sure.
which is a little more than most people. Nobody's legs are exactly the same.
Half a centimeter is like the limit of tolerance. So you're four times past the limit of tolerance with regards to having an asymptomatic leg length discrepancy. Half a centimeter is bad enough. So that, the chiropractors will come back and say, well, that's still enough to cause problems. The answer is affirmative, but it's not really enough to cause disability or impairment. 2 centimeters is. Okay, so your question.
Well, first of all, I will give you some back. 2 centimeters on the right leg, shorter.
Got it.
Okay, and
so that'll cause left hip pain, right shoulder pain, and left-sided headache. Typically,
that's correct. Mm-hmm.
Okay.
Very, very good. So with that in mind, I had flat feet.
Yes.
So no arches. So I had to wear clunky shoes, and one of them had to have a lift.
Okay.
So not fun at parties, apparently. Didn't get invited to a lot of things. I'm just kidding. But boy, can I dance. No.
Well, I mean, you can shuffle a lot, I'd imagine.
No, I trip on air still.
There we
so
go.
I rarely use a lift.
Okay.
Is that bad?
Well, at this stage of the game, okay, things are pretty well the way they're going to be. So the time that you really want to be focusing on things like scoliosis is when you can still do something about it. One of the beauties about going to a real pediatrician, so your kids, well, we're going to go to the family doc. They do every bit as well as the pediatricians. And the fact is they don't. They'll be screening for things like scoliosis and know when to pick it up and when to refer it. Scoliosis is something that can be mended when you're a child. 14, 15 years of age, get much older than that, you can't. But then there are things that you can do as a young adult to keep the scoliosis from getting worse. So you really need to call in a team effort for this sort of an endeavor. Once you get to your and my age, it's a bummer. Okay, is it helpful to use a lift? The answer is it might give you a little bit of relief, but it may also make matters worse.
It actually complicated things. That's why I stopped.
Yeah, because what happens is your body gets accustomed to be in one particular way, and as soon as you start to jack at the other, in some ways it's like a sapling tree. You can straighten them out before they start to grow sideways. So I was in Titusville yesterday, and we were driving up, actually it's at Merritt Island. We were driving up the island, and there were these 2 marvelous palm trees that were bent down to about 20 degrees. They shot out about 6-7 feet and then went straight up. So this was probably a result of a hurricane years ago.
Yep.
Why don't you go try to straighten those trees out and see if they survive? That's the way we are. So it's very, very difficult to straighten out something that is already baked in. So you want to fix this when you're young.
Got a couple of texts. One person asked me how I got into the military with flat feet and those other issues.
Because they didn't care at the time.
They did not care, and I was on profile almost the whole time because and had to wear sneakers because I ended up getting shin splints that were out of this world.
Yeah, they did. Yeah, that's an anterior tibial tendonitis from the way that you have to try to keep your toes up. So the military would take you in with all kinds of impairments if they wanted you badly enough.
Yeah, they weren't worried about that. Here's a text about having a sharp pain in the heel of my left foot.
Of
Any
course.
idea?
Again, it gets back to pump bumps or Achilles tendonitis. We'd have to look at something along the lines of tibial entrapment neuralgia at the ankle, but otherwise, give me a call at Stages of Life Medical Institute because I think I'm running out of time.
Yeah.
That's 407-679-3337. Better go on stagesoflifemedicalinstitute.com and hit contact us.
All right, we'll see you next Sunday at 4. I am Melissa Fox, and that's the doc. We love you. Mean it.
You've been listening to Stages of Life Radio with Dr. David Klein. Check out stagesoflifemedicalinstitute.com or stop by 1917 Booth Circle